Welcome. Today we will look at antipsychotic drugs. Fine. So we are looking at today antipsychotic drugs. Fine. These are also called as neuroleptic drugs or anti-schizophrenic drugs. Fine. These are very brief videos, as you know. See, in this, let us now understand the disorder. Disorder, you have to understand there are two types, neurosis and psychosis. Neurosis is where it's a minor mental illness. Let me make it green or orange for you. So it is a minor problem. Psychosis is a major problem, major mental illness. In psychosis, you have disturbance of thought, etc. And it is even the judgment capacity of the person is lost. And example for psychosis is schizophrenia. Okay. Now, example for neurosis, if you want, you can speak of obsessive compulsive disorder, anxiety neurosis, etc. Fine. Now, let us come to the main thing now, the classification of antipsychotic drugs. Here, there are a lot of classifications, but we will go with the main ones only, so that this is just like I told you to pass, right? So you have phenothiazines, then xanthines, one sec. So you have phenothiazines, thioxanthines, butyrophenone, atypical antipsychotics and others. Okay. Now, it's very difficult to know, I understand that. That's why we have given you very major drugs of this only. See, this is chlorpromazine. Chlorpromazine is an example for phenothiazine. Then you have haloperidol, which is an example for butyrophenone. Then you have risperidone, olanzapine and clozapine. Okay, olanzapine and clozapine as atypical antipsychotics, and you have others. Now, let us look at the mechanism of action of these drugs. See, when it comes to the conventional antipsychotics, they work on the limbic system and the mesocortical system. Okay, they work on what? The limbic system and the mesocortical system. Here they block the D2 receptors. Okay, they block the D2 receptors. However, when you come to the atypical antipsychotics, they work on the mesolimbic system and they are going to again block the 5-HT2 receptors, where in the mesolimbic system. So you remember the first classification, phenothiazine. Under this you had chlorpromazine. So the major question they have asked for you is chlorpromazine. So look at this, it is a prototype drug. That means it is one of the models of this group. And it is having this kind of structure. It has an aliphatic side chain. What does it have? It's called aliphatic side chain, that you can remember. Now, what are the actions of chlorpromazine? We have already seen that it works on the limbic system and the mesocortical areas, and it has an antipsychotic effect. The thing is that it also works on the 5-HT2 receptors also, and it causes antipsychotic. So it has even the atypical action here, right? That's what you have to note. So now, what are the other effects of chlorpromazine? You have to note this very important feature here. It works on the basal ganglia and it causes extrapyramidal symptoms. There are 4 extrapyramidal symptoms that you need to know. Those are Parkinsonism, dystonia, akathisia, and dyskinesia. Okay, Parkinsonism, dystonia, dyskinesia and akathisia. If you want, you can remember this like that. Dystonia, dyskinesia and akathisia. Okay, these are the some negative symptoms that it might cause. Okay. So let us look at the other thing it is doing on the brain. This is the chemoreceptor trigger zone. On the chemoreceptor trigger zone, it is actually causing something like a antiemetic, which is a good thing, right? You won't vomit. So on the chemoreceptor trigger zone, it is going to act and it is going to give an antiemetic effect. However, this drug is not used as an antiemetic. That is something you have to note, okay? Because it has a lot of other negative effects. On pituitary, it will act and it will cause the increased release of prolactin. So what happens if prolactin is more? There will be galactorrhea. That means there is spontaneous ejection of milk from the breast, though there is no childbirth or nursing happening. So this is not a positive thing. This can lead to amenorrhea because the body is conditioned to think that there is a, thinks that it is a post-childbirth situation. However, it is not the case, and this will lead to zero ovulation, no ovulation, anovulation, and hence it can lead to infertility in female, and in males it can lead to gynecomastia. Fine. So now let us move on to the other side effects. Major side effect that you have to write is sedation. Sedation is going to be a major side effect for all antipsychotics. Please remember that. Then you have the it acts on the alpha-1 adrenergic receptors and it causes postural hypotension, tachycardia and palpitation. You can definitely remember tachycardia, right? Then palpitation you can remember. Then it acts on the muscarinic receptors and gives an atropine-like action like dryness of mouth, blurred vision, constipation, urinary retention, just like the parasympathetolytic drugs, anticholinergic drugs, okay? So the pharmacological actions again explained here. Central nervous system in patients with schizophrenia, these are the benefits. It reduces the agitation, aggressiveness, it suppresses the hallucinations, delusions, it reduces spontaneous movements, it relieves the anxiety, it corrects the disturbed thought and behavior. It does not affect the person's intelligence, which is a very good thing, but it impairs vigilance. So can you tell the central nervous system actions on a schizophrenia patient? It reduces the delusions and hallucinations, it reduces the anxiety, it reduces spontaneous movements, reduces the agitation and aggression. It corrects the disturbed thoughts and behavior. It does not affect intelligence, however, it will affect the vigilance. Let us look at the endocrine functions. As you know, it increases the prolactin secretion. Now, how does this happen? Prolactin inhibitory factor is nothing but dopamine. Now, dopamine is being blocked, right? So, prolactin inhibitory factor is being blocked. So, when the inhibition is being blocked, the prolactin releasing factor acts more and prolactin gets released. This leads to galactorrhea and amenorrhea, infertility in females, and gynecomastia in males. We already discussed this, right? Tolerance to these, some of these negative things like sedation, postural hypertension, these occurs in few weeks, so the person has to get adjusted. Phenothiazines, they decrease seizure threshold and they may precipitate convulsions. So I'm guessing this is bad for epilepsy. Okay. So we are discussing chlorpromazine. Let us look at the pharmacokinetics, that is what the body does to the drug. Now, these chlorpromazine can be given as tablets, that's orally or parenterally injection. Now, these are highly bound to plasma protein. This is a very important thing you need to remember. They are highly bound to plasma protein. They reach high concentration in the brain. Where do they reach high concentration in the body? In the brain. Okay, where do they get metabolized? In the liver, and they get excreted in urine. Fine. Now, just let us look at a summary here on chlorpromazine. It blocks D2 receptors, M1, H1, alpha, all receptors are blocked. It is a low potency drug. It has significant sedation and hypertension. These are the side effects, and the other actions we have discussed, antipsychotic actions. Now, let us go to the adverse effects of antipsychotics.